Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is acute respiratory distress syndrome. So what is acute respiratory distress syndrome, or ARDS? This is a non-cardiogenic pulmonary edema and diffuse lung inflammation syndrome that needs to fulfill 3 criteria, which are acute onset, so within the last 1 week, bilateral opacities on chest x-ray, and a PaO2 over FiO2 ratio, which is arterial over inspired oxygen ratio, of less than or equal to 300 on positive end expiratory pressure, or continuous positive airway pressure of more than or equal to 5 centimetres of water. Risk factors and causes of ARDS are wide-ranging, and as you can see, they comprise factors such as infection, including sepsis, severe trauma, pancreatitis, alcoholism, drowning, smoke inhalation, as well as severe clinical pathologies such as disseminated intravascular coagulation, or DIC. Signs and symptoms of ARDS include dyspnea, hypoxia, an increased respiratory rate, pulmonary crepitations, pleuritic chest pain, cough, and multi-organ failure. ARDS should be investigated through a wide range of investigations, in addition to a thorough history and examination and bedside observations. An arterial blood cast should be conducted as soon as possible on presentation, as well as a series of blood tests, including those for sepsis, the BMP, amylase, and lipase. ECG needs to be performed, as well as a chest x-ray, and it's important to monitor urine input and output. Cultures should be taken of the sputum and blood, as well as swabs for influenza and COVID. An echocardiogram and CT thorax should also be considered early on. And this is a chest x-ray showing changes very typical of ARDS, and as you can see, there is bilateral patchy consolidation, which is quite classic of this condition. The management of ARDS does not comprise any specific treatment, and it's mainly supportive. It's important that patients suspected to have ARDS are discussed early with ICU at an early stage. Supplemental oxygen with or without mechanical ventilation is usually required, as well as proning. Antibiotics and antivirals should be given as indicated, and the patient may require steroids as per local protocol. So let's try a question. A 70-year-old man with a background of type 1 diabetes presents to the medical take with a 4-day history of being generally unwell, with shortness of breath and pyrexia. On examination, the IMT1 notes bilateral crackles at the base of his chest, with an oxygen saturation of 65% on room air. He is started on high-flow oxygen and up-titrated as per his oxygen sats. A chest x-ray reveals diffuse, bilateral, patchy consolidative changes, with no evidence of cardiomegaly. He is suspected to have ARDS and is referred to the intensive care unit. Which of the following statements is incorrect? So our options are A, an echocardiogram is indicated, B, he should be worked up for potential sepsis, C, COVID and flu swabs are indicated, D, a high-resolution CT chest is the first-line investigation of choice, and E, he should be considered for CPAP. So the correct answer here is D. You would not be considering a high-resolution CT chest scan as the first line. This would be done further down the line once the patient has had an established diagnosis and the immediate emergency treatment has been instigated. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.